All right, so when you come in to Maxwell Dental to have a checkup, especially at your first visit, we always offer an oral cancer screening just to see if you have cancer or any suspicious changes occurring inside your mouth. Most people don't know that dentists are primarily responsible for screening patients for oral cancer. I've actually had a couple of experiences where just random incidental findings in my checkup have led to a cancer diagnosis. So one time, I gotta tell you about this. I was doing a checkup on an older gentleman and I lifted up his tongue because oftentimes a lot of the cancer that we find is at the floor of the mouth. So I was lifting up his tongue and almost, I kid you not, it looked like another tongue was growing out of the bottom of his tongue. And it was absolutely shocking to me to see. Immediately, I was like, okay, we gotta get this thing looked at. And so we sent him to a specialist. And in fact, it turned out to be oral cancer and he needed major surgery. His tongue had to be cut in half and part of his leg had to be grafted into his tongue so it fully functioned. That was one example. Another time, a patient came in, and unfortunately, this was a really sad moment for me because I had seen this patient before, but it was just so brief. It was so brief. I hadn't seen her regularly, and so we weren't doing the full checks. We weren't doing a full checkup on her, and I had never done a full checkup on her. I had just seen her for a couple of really small things, but she looked at the top of her mouth herself at home and she saw there was a black spot there. So I was like, okay, I gotta see what this is all about. And I looked, and sure enough, on the palate of her mouth, there was black gum tissue. And it was very, very shocking to me because, of course, when you see something like that, you automatically think it's cancer. And it turned out that it actually was. So from this experience, it really just taught me once again how important it is to have regular checkups, regular cleanings, getting some professionals' eyes looking at parts of your mouth that you just never think to look at. And it's up to us, when we're looking, it's up to us to identify if there's suspicious lesions or suspicious areas that we need to be concerned about. And honestly, most of the time, it's nothing. We send you for a biopsy, and the specialist there will take a little sample of whatever we're concerned about, and most of the time it's nothing. But sometimes it is something and it's life-altering. So I want to encourage you to stay regular with your checkups, always get some professional eyes checking out your mouth, and in this way you'll have the greatest chance of catching anything, big or small, the earliest possible.